Hello everyone, my name is Susana Fuentes. Today I will be discussing a health topic that is imperative to an older population, undernutrition. I have witnessed firsthand how serious this issue can become in some older individuals. I would like to shed some light on the problem as well as some solutions that can be provided. So, what is undernutrition? It is a lack of proper nutrition caused by not having enough to eat, not eating enough of the right things, or being unable to use the food that one does not eat. It happens when the intake of nutrients or energy is too high, too low, or poorly balanced. Whether the loss of appetite is due to medication, depression, or simply changing taste buds, not getting enough to eat is affecting some 1 in 4 older Americans. In a recent poll, loved ones of older adults expressed that the impact of food mental clarity and mood, medication side effects complications, and lack of desire to eat were their highest concerns regarding senior nutrition. Signs of malnutrition can vary. Cognitive tells such as depression or lack of energy, as well as memory issues including dementia, may become present in older adults who are malnourished. Physical symptoms can be easier to spot. These include becoming sick more often, skin appearing easily bruised, dry and/or cracked than usual, or slow healing wounds. In addition to the previous physical symptoms, older adults who are malnourished may also have trouble chewing, weight loss, loose-fitting clothes, and/or muscle weakness. Other tells can be as easy as opening the fridge to see how much, if any, food is out of date. Undernutrition continues to be a major factor associated with mortality in older persons. In his article, diet specialist John M. DeCastro has stated that most often a reduction in intake produces malnutrition and impaired health. He has demonstrated the changes in eating behavior that occur with aging, including decreased snacking between meals that may potentially lead to physiological anorexia. In addition to the previous physical symptoms, older adults who are malnourished may also have trouble chewing, weight loss, loose-fitting clothes, and/or muscle weakness. Other tells can be as easy as opening the fridge to see how much food, if any food, is out of date. 60% of older adults in hospitals may be malnourished. Consequently, these patients may be required to stay an extra 4 to 6 days. This is a 300% increase in healthcare costs for those with poor nutritional status. With this issue on the rise, one can only wonder, why is malnutrition so prevalent in the senior population specifically? With an issue as prevalent as undernutrition, goals and strategies to achieve quality malnutrition care is critical and necessary. Some specific goals can be to improve quality of nutrition care practices, to improve access to nutrition services, to generate clinical research on malnutrition, and to advance public health efforts to improve nutrient quality of care. Let's start off with Goal 1, improving quality of malnutrition care practices. Well, what exactly would this represent? In specific terms, it would identify the effect of malnutrition and the quality barriers for older adults in overall regional population in health and action plans. As stated previously, it may be difficult to tell if someone is malnourished. While it may also be difficult for older adults to express their symptoms, undernutrition is something that can have complications down the road. Therefore, it is vital that we ask questions, encourage drinking of water and eating snacks, and to discourage alcohol. Let's discuss Goal 2, improving access to high-quality malnutrition care and nutrition services. This goal appears easy to comprehend, integrating quality malnutrition care by adopting clinically relevant accountability programs, while also reducing barriers to receiving the best care possible. But how does this goal come into effect? Social interactions such as a hired home care aide and assisted living are available options for seniors who have the financial support to afford these services. On the other hand, the federally supported program Meals on Wheels provides older adults, especially those on a fixed income, with receiving a warm homemade meal. This program is constantly searching for more active volunteers as it strives to address hunger and isolation that millions of seniors battle daily. Moving on to Goal 3, generating clinical research on malnutrition quality of care. This step would involve conducting national and state research on the different barriers that block some older adults into receiving the nutritional support they require. Through this goal, we can track clinically relevant nutritional health data. The issue present is that not all elderly adults have equal access to health programs. Social and economic constraints may be present as potential barriers to increasing malnourishment in some communities. Professor Adam Nudowski, director of the Center for Public Health Nutrition at the University of Washington, has stated that more information needs to be accounted for based on motivation for behavioral change and the benefits received from quality nutrition counseling. Our last goal deals with advancing public health efforts to improving malnutrition quality of care. This last step is especially crucial for older adults as it deals with early screening for those who are at high risk of becoming malnourished. This strategy has the potential to generate enough public attention that those who are predisposed to severe health issues can protect themselves beforehand. From this information, it is easy to say that health screenings are vital when caring for older loved ones. Getting a checkup from a physician or requesting a nutrition screening should be made easier to all populations, especially to older adults and low-income communities. Once a screening is complete, a specialist should have a personal consultation on its patient's daily nutrient intake and possibly prescribe supplements if needed. So why is undernutrition in older adults so important? After a closer analysis, it is evident that this issue is an effect of either one or more factor. While some signs of malnutrition can be difficult to spot, a combination of physical, social, and psychological factors can contribute to malnourishment. It is imperative that we promote the good health, independence, and increased longevity of our older loved ones. If you would like more information based on the topic that we have analyzed today, I ask that you visit one or all of the sites posted to seek further education. Thank you for your time.